Welcome to this educational video about toxic cataracts, specifically those induced by medications like corticosteroids. We'll explore what they are, why they occur, how they're diagnosed, and what treatment options are available. Toxic cataracts, also known as drug-induced cataracts, develop as a side effect of certain medications. Corticosteroids, both oral and topical, are a primary culprit. Other medications, such as amiodarone, chlorpromazine, and busulfan, can also contribute to cataract formation. The exact likelihood and severity depend on the drug dosage and duration of use, as well as individual susceptibility. Corticosteroids can disrupt the normal lens metabolism. They're thought to induce oxidative stress and alter the lens's protein structure. This leads to aggregation of lens proteins, causing clouding and decreased transparency. Specifically, posterior subcapsular cataracts, located at the back of the lens, are a common type associated with corticosteroid use. This location often causes more significant visual disturbance than other cataract types. Determining the precise prevalence of toxic cataracts is challenging, as it varies depending on the specific drug and the population studied. However, studies show that long-term corticosteroid use significantly increases the risk of developing cataracts. The risk rises with higher doses and longer durations of treatment. Individuals with pre-existing conditions like diabetes may also be more susceptible. The primary symptom of a toxic cataract is a gradual blurring of vision. This may start as difficulty seeing at night, sensitivity to glare, or changes in color perception. Patients often describe their vision as cloudy or foggy. As the cataract progresses, vision may worsen even in bright light, impacting daily activities like reading, driving, and recognizing faces. Posterior subcapsular cataracts, in particular, can cause disproportionate glare and visual problems, even when the cataract is relatively small. Diagnosis involves a comprehensive eye examination by an ophthalmologist. This includes a visual acuity test to measure how well you see at different distances. A slit lamp examination allows the doctor to examine the lens and other structures of the eye in detail. Dilation of the pupils may be necessary to get a clear view of the back of the lens. These assessments help determine the location, density, and extent of the cataract and rule out other possible causes of vision loss. While we generally refer to toxic cataract as a broad term, the specific type induced by corticosteroids is often a posterior subcapsular cataract or PSC. This means the clouding primarily affects the posterior portion of the lens, located just beneath the lens capsule. Other drugs may lead to different patterns of cataract formation, such as cortical or nuclear cataracts, but PSC is the most commonly associated with steroid use. The primary treatment for a toxic cataract is cataract surgery. During surgery, the clouded lens is removed and replaced with a clear artificial lens, called an intraocular lens or IOL. The most common technique is phacoemulsification, where the cataract is broken up using ultrasound and then suctioned out. Cataract surgery is a highly successful procedure with a low risk of complications. Following surgery, most patients experience a significant improvement in their vision. The best way to prevent toxic cataracts is to use medications, especially corticosteroids, only when medically necessary and at the lowest effective dose for the shortest possible duration. If long-term corticosteroid treatment is unavoidable, regular eye exams are essential to monitor for cataract development. Discussing the potential risks and benefits of medications with your doctor is crucial before starting any new treatment. Consider discussing alternative medications with your doctor if available. The prognosis for patients undergoing cataract surgery for toxic cataracts is generally excellent. Most people experience a significant improvement in vision following surgery. However, the specific visual outcome depends on factors such as the overall health of the eye, the presence of other eye conditions, and any complications that may arise during or after surgery. Recent research focuses on understanding the molecular mechanisms by which medications induce cataracts, with the aim of developing protective strategies or alternative therapies to minimize the risk.